Hello everybody. How are you doing? Hope you're well. I welcome you back to my YouTube channel. My name is Jamie Naftali. I am a pediatrician by profession. So this channel is about kids' welfare. Here I educate mothers on common illnesses affecting children while growing up. If you're new, join the family by hitting the subscribe button. And if you're that returning subscriber, thank you so much. You are a favorite person and you don't even know it yet. Thank you. Welcome back to this channel. It has been a minute, I know. So now I'm back with another new video. And today I want us to talk about leukemias in children. So these are blood cancers, the cancers, childhood cancers. This is what I want us to talk about. So keep tuned. So stay with me so that until the end, so that we can exhaust and try to understand the leukemias in children, the blood cancers in children. So leukemias, like I've said, by definition, these are blood cancers. Yes, these are cancers of the white blood cells. Usually affects the abnormality of the cells are usually at the white blood cells, specifically the leukocytes. So the white blood cells, the WBCs, these ones are the cells that are usually affected. So it is a cancer of white blood cells, and which are the cells, and these are the cells that help to fight infections in the blood. So then another thing is that diagnosis, it usually it develops in the disease usually develops in the bone marrow. So we are saying it's the white blood cells that are usually affected, and we know very well that these white blood cells, the WBCs, are the ascaris of the body. These are the ones that guard the bodies against infections. So you can imagine when these cells are affected, the immunity goes down, and eventually we get these problems and it becomes a problem again. So this is it. It affects the white blood cells, and usually we are saying it is usually in the bone marrow. So I hope now you get that. So childhood leukemias is a common type of cancer. Childhood leukemia, yes, it's a common type of cancer in children and also in teens. This is very, very common. It has become so common nowadays. Yeah, the leukemias, these blood cancers, they have become so common. And what happens is that we are saying it starts in the bone marrow. So after forming in the bone marrow, what happens is that they travel through the bloodstream. So through the bloodstream, through the blood circulation, they crowd out the health cells. Hence, the body's chances of infections and other problems occur. So we are saying it starts from the bone marrow. After forming it, they go and engulf or crowd out the health cells. Yeah, so and here the problem starts. We have got body's chances of infection increasing. So remember, we are saying it's the white blood cells in the blood that are usually affected. We have different cells in the blood, white blood cells, red blood cells, but we are saying in this case it is the WBCs, the white blood cells, that are usually affected. Now, what are the causes of leukemia? I know this is a big question that people ask themselves because it has become so common. It is very, very common. So what causes these leukemias, these blood cancers? So the truth is the cause is unknown. What we have are something we call predisposing factors, the risk factors to getting these leukemias. So number one risk factor for childhood leukemias, we have inherited disorders. These are disorders, the chromosomal disorders, like for example, the Down syndrome, the syndromic diseases. These ones, the inherited disorders, can risk a child into getting these leukemias. We also have inherited immune system problems. Also, if a child has got a brother or a sister with leukemia, especially the identical twin, so they are most likely to come back and get the leukemias. If there's familial disease, the familial leukemias in the family, there is another child with leukemias, so the chances of it repeating itself, it is very, very high. Yeah, so please note that. Other risk factors are a history of being exposed to high levels of irradiations, yeah, or chemicals like benzene. So irradiations, if I may try to explain, is that when you see a baby, every time a child is going for x-rays, scans, so those are the exposure to irradiations. These are the irradiations we are talking about. So most probably you are going to find that exposure and recurrent exposures to these irradiations may become a risk factor to blood cancers. Yes, if there's a history of immune system suppression, e.g. organ transplant, or any other history that is causing immune system to go down, even children with HIV, so they are most likely to get leukemias because the immunity is already down. And what these leukemias are going to do again, are going to even suppress the immunity even more. So you can imagine, yeah. So children with these high risks should get regular checkups so that we can spot the problems even early. So if we have the risk factors that we have talked about, so these children, we need them to have regular checkups so that we can pick the problem early. So if these cancers are known early, something can be done and we can really save a lot. Yeah, so it is good to try and screen them even early, those children with this. However, it does not mean the risk factors that we have talked about. If a child has a high risk factor, for example, if there is a baby in that family that also had leukemia, it's not a must that there is someone a child in that child must get cancer because their brother got or anything. But these are the risk factors, so it's good to know and to be very, very keen about it. What are the types of cancers that we know? The types of the blood cancers. We have two common ones. We have the lymphoblastic leukemias. We also have something we call myeloid leukemias. I know these might be difficult names to even to utter, but just know we have two types, common ones, lymphoblastic, and also we have myeloid. In each we have acute and also chronic, meaning that we have acute lymphoblastic leukemias. We also have chronic lymphoblastic leukemias. Then we have acute myeloid leukemias and chronic myeloid leukemias. So acute means the disease starts rapidly, and for these children that are the disease starts rapidly, we're going to see that these are the children that will present with signs and symptoms, yes. But for those with chronic, it starts slowly and you might not be able, at the start the child might not be having any sign and symptom of anything. So this is the difference between the acute and also the chronic. But remember, we have the acute lymphoblastic, the chronic lymphoblastic, we have acute myeloid, and also we have chronic myeloid. So what about the signs and symptoms? For those that start rapidly and have signs and symptoms, how do these children with leukemias present? We're going to see they present just like any other disease. So first we have, these children are going to have fatigue or even pale skin. So very, very fatigued. If it's a bigger child, they even complain and tell their mothers that they are getting tired. If they're able to talk, bigger children, yes. They're going to have pale skin. Pale skin, you're going to find that, like, this is where we're able to see that the child does not have enough blood. So like the palm becomes so white, and this is what we translate by saying this skin is pale. They have got infections and fevers. This explains because we are saying the leukemias will go to affect the white blood cells which are the ascaris of the body that prevent the infections from the body. So if they are affected, these children get recurrent infections and also high fevers, yeah? Fevers of even 40, very, very high fevers. They are going to have easy bleeding and also easy bruising. So if they get a small cut, this child is going to bleed and lose a lot of blood. So this is something else that you are going to say it's a symptom. You're able to tell this could be leukemia. Something small, they get bruised very easily. So this is a sign and symptom of leukemias. They also have extreme fatigue, we have said, or even weakness. They're very weak. Their bodies are very, very weak. They also have shortness of the breath. We call it dyspnea. Sometimes they have difficulties in breathing. They also have bone or joint pains. Everywhere, every joint is paining. They have swelling of the abdomen. They have the swelling of the face, the arms, also the sides on the neck. You are going to see some swellings all over. So this could be a sign and symptom of leukemias. They have headaches, seizures. These are convulsions, or in layman, these are the tremors, the convulsions. They're going to have balancing problems or even abnormal vision. So this again is a sign and symptom of leukemias. They get vomiting so easily, and also they have got gum problems. Again, bleeding from the gums. We are saying they get bruised so easily, they get bleeding so easily. So even the gums are going to start bleeding anyhowly, without any cause. So these could be signs and symptoms of leukemias. So how do we diagnose leukemias? How are we able to say this is leukemias? To start with, we are going to do a thorough history. You take a thorough history from the mother. This one is going to contribute a very big percent. Next thing you're going to do as a doctor, you're going to do a physical examination. This is where you're seeing the swelling when you do the physical exam, the tenderness of the joints. You do all that. So history taking and also the physical exam play a very big role. Now we come to now the tests again to diagnose the leukemias. The tests that we do are usually the blood test and also something we call the bone marrow aspiration. The blood tests are things like full hemogram. Full hemogram, we want to see the levels of the white blood cells. Remember, they're the ones that are affected. We also want to see the level of blood in that body of this child. So we call it the HB. Most probably children with leukemias, the HB is very low. It is as low as 5, yes. It is as low as 5. So other things is white blood cells we need to check. In other cases, they are very high, very elevated, and this translates into the infections, and this being highly elevated, this one could be a sign that we are dealing with cancer, blood cancer. Also, sometimes they can be all very low, again translate that there's a problem. So BMA is bone marrow aspiration, and also things we call biopsy. So a bone marrow aspiration, it's a very dangerous procedure, if I may say. Very painful to this child and even to the parents, because what we do, it is done at the pelvic bone. You can imagine the pelvic bone, the pelvic bone. So you are drilling that bone to get the bone marrow. You can imagine very painful experience and bad experience to the parents. So we get the bone marrow aspiration and also the biopsy. The biopsy, you get a part of the body parts to take it to the lab for something we call hematology, yes. So this is what we do. So blood test and also the bone marrow aspiration. And the bone marrow aspiration and the biopsy is what confirms the leukemias. This is the confirmatory test that you're able to say we have leukemias. These two, the biopsy and also the bone marrow aspiration. These two diagnose the leukemias. So other tests we do are LP, the lumbar puncture. You check for any spread of leukemias. So certain tests as the journey goes on are usually repeated. So these are some of the tests that we do. So treatment, how do we treat these leukemias? Does it even have any treatment? How do we go about it? So the treatment depends on the type of the leukemia. So childhood cancers tend to respond to treatment better than the adult cancers. Yes, that's the best thing, that they're able to respond even faster and better. So before the cancer treatment, the child needs to be treated for the illness complications. Yes, so they may need things like antibiotics. Remember, we are saying they get recurrent infections every time. They have got high fevers, so the only way to treat this is by giving antibiotics. Other things we may need to do are blood transfusions. We said the blood level, the HB may be as low as 5 and even less, yeah, because we don't have enough blood completely, and that is why we said their skin is very pale. So we might need to do, not we might, but in most cases, we do blood transfusions. Remember, I did a video on blood transfusions. If you have not seen it, please check on the videos, a recent video I did on blood transfusion. So those are the treatment of the illness complications. So the mainstay of treatment of this cancer we do is chemotherapy. This is the main treatment, and the chemotherapy are now the drug cancers themselves. So we either give by mouth or through the vein. So, and we may need to do maintenance therapy. This is to prevent the leukemias from returning, to prevent them from coming back every time. So we may need to do in cycles of 2 to 3 years. We are doing to try to maintain on maintenance. And for your information, they're very expensive. They're very dangerous, they're very strong. So this is something these parents and these children undergo again a lot of counseling. We prepare them psychologically on what the journey they are beginning after the child has been diagnosed with cancer, so that they can be able, they are prepared psychologically. The drugs are expensive, the drugs are very dangerous and all that. They need to eat well. So chemotherapy, we are saying, is the main treatment. Other things, we have radiotherapy. Yeah, radiotherapy is a high energy radiation, and this is to kill the cancer cells and make them shrink. So the cells shrink. So it's like kuchoma, tunachoma. This is the radiotherapy, so that these cells can shrink. We also have surgery as number 3, but surgery is rarely done. It is a rare option. So you find that the most thing we start is chemotherapy and also the radiotherapy. So surgery we do in cases whereby completely we are not benefiting with chemo that much. So, and the cells are very many, but we need consultation for us to do this surgery. So this is the surgery. It's rarely done. It's a rare option. Yeah. So if the treatment is less effective, where do we go? If the chemotherapy, the radiotherapy are less effective, now we do something we call the stem cell transplant. This is the best option. So the stem cell transplant. So we are going to the parents are advised to get a donor. It's a donor that gives us this stem cell, and mostly a family member, a close member. They're the ones that donate these stem cells to give to this baby. That's why you hear of people going to cancer, children going to cancer to get stem cell transplant. So it is put in them, so because their bone marrow completely does not work. So that is where we go up to. If at all the radiotherapy, the chemotherapy are not able to work well, so we only go to stem cell transplant. So this is the last option. This is the last option. So like we said, the disease is very, very draining. It is very draining. We have to tell the parents the disease is very expensive. So we said, like we said, if you know the high risk that we just said, these children need to get screened even early. So this is it. I know this video will help a lot of mothers, a lot of people with children with these leukemias. They are all over in the hospitals. So I hope you get encouraged. I hope now you understand even better what these leukemias are. So thank you so much for keeping tuned. If you have not subscribed again, please hit the red button, subscribe to be part of this wonderful, wonderful family, because this is a family. Put on your notifications to know every time I'm posting a new video here. Thank you so much. Until next time, bye bye.